Good evening, everyone, and welcome to Have a Seat with Chris Hansen. I'm Chris Hansen, and this is our fifth in a series of COVID-19 specials that we've been doing. Tonight, we are very fortunate to have another group of fascinating guests who will take us inside the battle against this pandemic. They are on the front lines in many ways. Sandy Dorsey will be joining us, who's a critical care and acute care nurse at a major medical center here in suburban Detroit, where I'm at. We'll visit with Stokes Nielsen, who you may remember from being on our show a few weeks ago from Nashville, Tennessee, songwriter, musical manager, who himself battled COVID-19, recovered, and just today, donated plasma in an effort to save others. And we also have someone who may be one of the youngest people in America voluntarily on the front lines of this battle against COVID-19, Isabella Johnson, who's a high school student who works at another hospital here in suburban Detroit. As I mentioned, I've been in Michigan for the last 4 or 5 weeks. The numbers are staggering still. Here in Michigan, 27,000 COVID-19 cases, 1,768 deaths. Now, just to put this in perspective, when the governor, Gretchen Whitmer, first announced restrictions here in Michigan, she had a news conference on like a Monday night. There were 12 cases then. That was 4 weeks ago. In New York City, where I lived much of the time, there are 30,780 deaths. New York State, we're looking at almost 11,000. Across the country, 27,000. Staggering, but there is some positive news tonight. It appears in New York, here in Detroit, Michigan, and across the country, the numbers are leveling off. The number of new hospitalizations is dropping. So with that, I want to first go to Sandy Dorsey, who is also a leader in the nursing union here. Sandy, how you doing tonight? Are you hanging in there?
Day by day, Chris, day by day.
Tell me about the last day you were in the medical center. What was it like? What do you see? Take people inside.
Well, I work a 12-hour shift. So as we come into the institution, we are given a mask to cover our faces. So all employees are masked, and that's the mask that I continue to wear all day. My patients are sicker than they ever have been, and we're also in pandemic staffing. So I have more patients than I've ever had. My floor now has a sicker population with much oxygen and now getting aerosol oxygen, heated high flow, which is a very important step right before intubation. So these patients are very ill and breathing wise, and that requires a certain amount of protective equipment that we need to wear. So I've got that on all day with gowns and gloves and masks and face shields for a 12-hour shift.
Sandy, you've been doing this for some 40 years now. How would you categorize this pandemic? Have you ever seen anything like it? Plane crash, anything else?
You know, Chris, I've lived through SARS and MERS, and I've lived through AIDS, and at a trauma center, many horrible accidents, but never anything like this. Not only do I have to worry about my sick people, but I have to stop. I have to stop and worry about myself and my fellow employees, because I can't run in a room like nurses and physicians do when there's trouble. I have to stop and put on garb, and if I put it on wrong, then I endanger everybody I'm around because I can carry it. One of the latest studies, small study that just came out today from the CDC from Wuhan, saying that we medical people can carry it on our shoes as we exit the patient room. And other studies have shown that a sneeze can travel 13 feet. So that if I don't have the proper equipment, I can carry that around, bring it home. As it is, I come home after 12 hours, get in the utility room, strip down, run to the shower, and scour myself.
Do you have what you need equipment-wise, PPE-wise, Sandy, to do your job?
At different days, but no, I don't have what I feel like I should have, what the CDC originally said I should have, what the WHO originally said I should have. I should have N95 mask on because I am at the bedside. I am there longer than anybody. I don't come in and go out. If a patient doesn't cover their mouth or wear a mask, they sneeze. I have gaps in the mask that they give me. So no, I don't feel like I'm protected. There are other times in a certain situation, if I'm in the intensive care, dealing with a certain kind of patient, that I have a mask, an N95, a face shield. The face shield that the hospital gave us, a physician walked out of the room yesterday, and the little plastic part on this face shield, he had sweated and it melted the glue and it was coming apart. That's not the appropriate protection. Yet my hospital will not let me bring in my own equipment, where a friend has given me a face shield that fits like a World War I helmet, and the face shield goes continually around and protects me from everything.
And why can't you bring this into the hospital with you?
Well, the policy says, or administration says, or the leaders that sit in their office say that it's because it's not fit tested, or they don't know the quality. Fit testing, Chris, is a way that they can test the mask to make sure that certain aerosol particles don't get through the mask. So they test you with this N95 yearly to make sure that it does fit you properly. But they won't let me bring one from home or set up a station that will fit test, or a face shield that I have that's much safer than the one who melted on the physician yesterday, doesn't need to be fit tested. But yet, because they can't vouch for the quality, and yet the mask that they give me to wear all day has no quality. It has gaps in the side and gaps in the bottom.
From your standpoint, and again, Sandy, you're on the front lines here, is it getting better? Do you see an improvement? Where do we stand at your institution? And I think where you are is a pretty good bellwether for what's happening across the state of Michigan. Obviously, Detroit proper has it worse than anybody else, but you're right in the thick of it. Is it getting better?
From my perspective, no. I think it's leveled off, and I haven't seen the numbers at my institution that the inner city of Detroit has, but the numbers that I see are sick, sick, sick people.
And are these people recovering? I know you don't have the specific numbers, but do you see people get better? Are people dying? And they're dying alone when they do die, which is, to me, one of the most heartbreaking parts of this, is that family can't even visit them or be with them as they battle this.
Absolutely. It's horrific. Patients do get well and they do exit the institution. What we see on the institution are the sickest of the sick. And you're right. We just lost 3 in the last 2 days. And trying to garb up as the nurse, and before this, I could sit with this patient so that they didn't die alone if they didn't have family. Now I struggle to get them on, and again, I've been doing this 40 years, so I'm not the techie, but I'm struggling to get them on FaceTime or Zoom or something so that their family can be with them at this horrific. It only adds to the sadness, Chris. You care for these people, you don't feel protected yourself, you're trying to give the best care you can give, and you can't even bring the family in to be with these poor patients at the very last moments of their life. So there's sadness all around.
So what do you do in a situation like that, Sandy? Do you actually hold the phone and
I go in, I garb.
You communicate with the family, or how does that work?
We call the family and get them to Zoom or to whatever we call it, FaceTime, to see their loved one, to give them a status, and to share their last moments. But again, Chris, you can't stay in there forever, because you now have twice as many patients as you've ever had that are also sicker than you've ever had. So it's really very frustrating.
Has your hospital, your medical center, become a COVID-19 hospital? Is that really all you're dealing with at this point?
I would say 75% to 80%, yes. People are staying away from the hospital if they can all possible, as they should. But there are still a few admissions that have to be admitted for certain diagnoses that they just have to be treated. But when at all they can go home, physicians are trying their best to get them out of the hospital as quickly as possible.
And how many personally have you seen? How many COVID-19 patients have you personally seen, do you figure?
Probably 30, 40.
30. And how many casualties? How many have gone home? How would you break that up?
Probably a handful for me have gone home. The others are still there and still sick.
And you hear about the ventilators. Do you have what you need there? Do you see people going on the ventilator and then recovering?
There's a certain portion of patients that recover, but again, Chris, they are the sickest of the sick that have to be put on ventilators with very many other comorbidities. So sometimes even on a good day, that doesn't work well. But with this horrible virus, only 20%, I think, is the stats that come off the ventilator.
From where you operate and work, what is the key now to continue to flatten the curve to get through this? What should the medical people be doing? What should the medical centers be doing? And what should just your average citizen be doing?
Well, obviously, the staying away from each other has worked. That certainly has helped. I would like to see everybody being able to wear the PPE that they feel they need to wear, that we all were dressed in 95s and masks and face shields, that we had the time to dress and undress as properly as we can, that we had spotters to make sure that we're not flinging this virus around as we undress, that we had enough staff to make sure that we can care for these people. And other than that, I guess, Chris, I've never prayed so much in all my life. So we have prayers and so excited to hear how this plasma will go if they give that plasma to sick people to see if those antibodies can help fight this virus. It is the most anxious time I've spent in my 40 years in critical care.
What's the saddest thing you've seen, Sandy?
Probably the suffering at the end, the painful death, that the loved ones, not only sad for the patient dying, but that their loved ones can't share their final moments together, that they can't come see them, that they can't bury them. I guess that's the saddest part for me.
And have you had colleagues become ill? Has anybody on the nursing staff at your institution gotten sick?
We've had actually quite a few. Our numbers doubled yesterday as far as staff getting ill. I fortunately have had 2 nurse friends who have gotten ill, gotten sick, and gotten better and returned to work. So they're very lucky.
So you have at least 2 fellow nurses who have caught COVID-19, recovered, and have gone back to work.
Correct.
And what do you do yourself? What is your protocol to try to stay healthy? I mean, obviously on the job, you have the PPE and everything, although not all you want, but what you're given. What do you do personally to try to keep yourself healthy, to keep your immune system where it should be?
I eat well, I exercise. I've moved out of my husband's bedroom 3 weeks ago when this started. I stay away from him, stay away from family, exercise, and try and keep a positive note, Chris. We will get through this somehow, some way. I just hope we all get through it well, with our families intact, with our emotions intact, and try to stay as healthy as we can in the meantime.
Are we weeks away from turning a corner here? Are we months away? Where are we, in your opinion?
I have no idea, Chris, but I don't think it's weeks. I think it's much longer. And what the experts say is we may have a resurgence. I just hope we take our time. Things are a mess. We're all a mess. We are staying away from loved ones. People aren't working. It is a very scary time, but we can't rush back into things expecting that we're going to go back to normal. We don't have this thing knocked yet. No way, shape, or form do we have a better handle on it. We keep learning every day more and more, but we have to take our time and listen to the experts.
All right, Sadie, I'm going to have you stand by and and hang with me for a minute. I want to go to Stokes Nielsen in Nashville, Tennessee tonight. Stokes, how you feeling? You had a rough go with COVID-19 for a few weeks there. How are you tonight?
I did. I actually feel great. And I want to say something to Sandy. And she talked about, prayer and faith and all that. And I just want her to know you are absolutely someone's angel. And, whether that is being by someone's side, to help them talk to their family before they go, or to be that person that actually is the reason why they're leaving the hospital. I had somebody like that basically got me in to get a test early on that was a game changer. And I just want to say thank you from the bottom of my heart, and everybody who's gone through COVID-19, thank you for what you do. You truly are an angel. So thank you for that.
Thanks, Stokes.
Stokes, Sandy brought this up earlier in our conversation, and I'm fascinated by this. You actually went in yesterday and were tested once again for COVID-19 after your, week or so long battle. You are now negative, and today you went in to give plasma in the hopes it could be used to save other COVID-19 patients. What can you tell people about the importance of this? Obviously, medically, it could be a game changer of sorts here.
Well, it's crucial because right now, I think a lot of the country has been focused on the containment strategy of the virus. And I think that it is incumbent on anybody that has survived COVID-19 and has the antibodies inside them that can fight this virus to get into the war, because we need to get into the virus stage of this. And currently, COVID-19 survivors with the antibodies that they have in their plasma are one of the few weapons that we can use against this virus that is working. And so for me, it was really important once I got recovered to find out how I could be a part of the COVID-19 plasma convalescent donation system. And I will say that in itself was its own challenge. I reached out to 6 different programs, and at that time it was very nascent and it just started. And of those 6, one got back to me within 6 hours, but everybody else was like 4 or 5 days later. And the more I researched it, the more I saw that other COVID-19 fully recovered patients that wanted to donate didn't know how to. So we started an initiative called the +2 Project. It's called +2, Chris, because they are finding that from the plasma donations, you can beneficially affect 2 to 4 critically ill COVID-19 patients.
So tell me, Stokes, what did you actually do today? How were you able to donate plasma in this +2 effort?
Yeah. So in Blood Assurance, which is the organization in Tennessee, had a plasma donation drive at Williamson County Medical Center. So you go in, you have to register online. You go in, you get hooked up to the plasma machine that then extracts your plasma from your blood. It does replace your blood platelets back, but that's the way that they are getting the plasma from the COVID-19 survivors.
Sorry, Stokes. Once they do that, where does it go? How does it get to the COVID-19 patients who might?
Blood Assurance is getting that to the hospitals the following day, and in a lot of cases, they're getting to the patients that next evening. So, and they had a report tonight on our local news where there was a patient in critical care that got this infusion, and now he's about to be released. So, and this is happening all over the country. What's important is getting these COVID-19 survivors in those plasma donation chairs is crucial right now.
How do we get the word out about that? And when you think about it, for every guy like you who's had it and recovered, that plasma, your plasma, could save 2 to 4 other people who are in critical condition.
Exactly. It's got to be a huge public relations effort. Honestly, it's got to go out through radio, through television, through social media. I mean, one of the reasons why I appreciate the chance to be on your program is you have a great audience out there who's very active on social media. And I would just say anybody that's out there that knows someone who has gone through the COVID-19 quarantine and wants to donate, please get them to do it, and they can go to plus2project.com and we will connect them with the local people to do that.
Stokes, you're a very goal-oriented, mission-oriented guy, and I've known you for some time, both in the music industry in Nashville, business, politics, movements like this. What do you tell people? How do you characterize how important this is for us getting through this pandemic?
Well, we have to kill the virus. And to kill the virus, you need either a vaccine or you need a bunch of antibodies. So we've got a bunch of COVID-19 survivors who are now coming out of quarantine with those antibodies, and we need to put them in the war because we have to kill this virus. Containment is not enough. What happens when people get out of stay-at-home orders and then the virus has not been dealt with? It is time to deal with this virus, deal with it definitively. And one of the keys right now is COVID-19 survivors and their plasma.
And what about the antibody? What about people who have the antibody who have been exposed, but either had a very mild case or didn't have any symptoms at all? Those people can be helpful too, right?
Absolutely. I think, if you look at the hierarchy of it, it's phase one, which is the people who have actually gone through it and beat it. And the second phase are the people who were exposed to it and have those antibodies. And again, that's why testing is so important with all of this, and having antibody testing, and not just saying that you're going to have testing, but actually deliver massive testing so that we can get these people into a plasma donation chair and get their antibodies into the game.
All right, Stokes, I want you to stand by here because I want to get to our other guest this evening, Isabella Johnson, 17 years old, a high school senior in Shelby Township, Michigan, just east of Detroit. She goes to school at Henry Ford II High School, but is now part of a co-op program because she wants to go study nursing in college next year at Beaumont Hospital, Troy. Isabella, thanks for being with me tonight. How you doing?
I'm great. Thank you so much for having me.
You're a high school senior, but you are in the middle, on the front lines, in the battle against COVID-19.
Yes, it is definitely a crazy experience I will never forget.
So you're one day essentially a nursing assistant, getting credits in high school because that's what you want to study in college. How do you come to grips with the fact that you are suddenly in the middle of a major international pandemic? And what did the people at the hospital tell you as a high school co-op student, essentially?
Well, actually, every co-op student, we were all given the choice to quit our jobs when quarantine started and when they shut down school. There's actually not very many of us that are still working. A lot of students decided they wanted to stay safe and stay at home, but I was given this wonderful opportunity. And I asked my manager at work, I just asked her, I just wanted to keep working. I just wanted to help out the people that are actually sick. Not many other people get this opportunity, and I couldn't let it down.
What did your parents say when you first told them that you had the choice to, not do this, but you were adamant that you wanted to? What did your mom tell you?
The first thing my mom said was, there is no way I'm letting you back in that hospital. But then we talked about it for a second, and she realized that it's at the end of the day, it's my choice. I'm the one I'm risking myself to go into the hospital. And I told her that I have so much faith in the nurses and the physicians and everyone that I work with. And I'm so comfortable there in my unit. And I just told her that this is going to be my career in the end. I didn't want to pass up this opportunity, and I just wanted to help. I figured another pair of hands, it was better than nothing.
And what are you actually doing every day, Isabella? Tell me about your day when you go into the hospital.
So my unit now is a COVID unit. We were originally intensive care, but now since that we transferred to a COVID unit, as nursing assistants and like if you're a clinical assistant, our main job is to help the nurses put on and take off all the PPE when they go in and out of the rooms. But there is times where I do have to go into the rooms with the nurses, especially doing Q2 turns, because now a lot of our patients are on ventilators, so it's very important to still do the Q2 turns so nobody gets any pressure wounds or anything like that. And yeah, we do have to go in the rooms a lot, so that is very scary.
And obviously you have help and you're very cautious about putting on the PPE gear. Tell me about that process for you.
So originally we did have N95 masks, but we actually ran out. So I believe they're called like 3M masks. We had to get fit all over again with these new masks. So that's the first thing that we put on is our big mask. And then I put a surgical mask on top of that because we have to keep the 3M mask that's like your mask. We have to write our name on it, our badge number. It gets reused after each shift. They clean it, and that's you use that for every room you go in. But then I put a new surgical mask on, different for every room. That's just what I like to do. And then even though I have glasses, I put goggles on top, and then I put a hair mask. I have to put my hair up in a bun just so nothing gets out. And I put a hairnet on, and then a face shield over it that covers all of it, basically down to my chin. And then I have to wear an isolation gown that basically covers down to my shins. And then I have a pair of gloves, then the isolation gown, then another pair of gloves. So there's basically, and I put shoe covers over my shoes just as an extra precaution too. So there's basically nothing that's really open.
Now, most high school seniors right about now are most concerned about not having a graduation ceremony, not having a senior prom, not having a party before they go off to college. You are going into a hospital, into a COVID-19 ward. What is your biggest worry right now as a high school senior, Isabella?
My biggest worry is that I'm not really afraid that I'm going to get it. I'm more afraid that I'm going to get it and I'm going to give it to my parents. I mean, those are really the only people that I have any contact with right now are my parents that I live with still. But even with that, I've been trying to be extremely cautious. Like I started sleeping downstairs. I know they're still like very healthy people. Since this has started, we've all trying to like exercise more and eat better and take a whole bunch of vitamins. But I think that's my only fear right now is just I'm afraid I'm going to get them sick. Worst case scenario.
What's the most important thing you've learned this semester of your senior year, Isabella, by doing this?
It's definitely kind of taught me that the little things that I used to think were such a big deal, they're not really that big of a deal in the grand scheme of things. Like when I got the email from the school district saying that like they canceled like school for the rest of the year, like they said there's no way we're going back into school. That day we had a patient die in our unit, and I didn't get the email until I got home from work, but it learning that we weren't going back to school, it just didn't affect me that much. Like all I could think about was that poor patient who passed away and their family couldn't be there to help them. And I just felt so selfish, like thinking about myself and feeling bad about myself when all of this in the world is just so much worse.
How much growing up have you had to do in the last 5 weeks?
A lot. I think it started right when I started my job back in July. I've seen things that I've never had to deal with in my life. Like before this, I was in my own little shell, and this is just it's such a surreal environment that I was thrown into, and I couldn't be happier about it.
When you were given the choice of going home and not having to go to the hospital for the rest of your senior year, was that a difficult decision to make? Did you think for a minute, well, maybe I should just be at home? This is a lot to handle for a 17-year-old high school senior.
To be honest, that thought didn't really cross my mind. I just knew that you can always use an extra pair of hands, even if it's for an extra couple of hours a shift, or even if it's just extra. Even if I get to help one person, that's still one more person that's being helped if I wasn't there. So that was the only thing that I could think about. I just wanted to help.
And what do you tell your friends who are also high school seniors who obviously aren't getting the experience you're getting? What's the most important thing you can say to them?
I've definitely been trying to tell them to, this sounds kind of harsh, but I've been kind of telling them that it's not that big of a deal. Like, we'll still have some sort of graduation. I'm sure we'll still have some sort of prom, even if it's in someone's backyard, that you want to worry about your health and your safety first, and the health and safety of everyone around you first. That should be everyone's first priority right now. And I would just tell them you need to stay home. And thankfully, most of my friends are pretty smart, that they've all been staying home and everything, which is very good. But yeah, that's what I would have to tell them.
I learned a long time ago that it's important to listen to the youngest person in the room, because if you don't, you're going to miss something. As the youngest person in this room, perhaps in this battle, what is your best advice to the rest of the country as we battle this tonight?
I think the best advice I could give is to definitely look at all news sources and just try and get as much information as possible and sort through it all. Don't just look at one source, and try and get all the information you can get, and definitely be safe. I think that's like the best thing that anyone needs to think, is just be safe.
All right. And day to day, what do you tell the other kids? Don't go out. Don't go to McDonald's.
Yeah.
Don't even go to the
Yeah.
drive-thru.
Yeah, and I've definitely
Kids are getting antsy.
yes, they are. And I've definitely been getting a lot of text messages like asking me about the hospital and like how it is. And I do feel kind of like proud that I get to be that source for people, that I get to like accurately tell them how it's going, at least accurately for my, like in my opinion about what's going on in my unit in the hospital. So it is kind of a good moment to be able to help spread the good information.
Have you been getting on social media and giving your advice to your friends, to other students who've been doing that at all?
I've just been doing it to the people that have asked for my opinion. I haven't really been going out on social media and just kind of like spreading it. I just feel like there's so many opinions going around. And I feel like most people are following the good opinions and good research out there. But if anybody asks me about what's going on, I love my job. I like talking about it. So
All right. Isabella, I want to bring in Sandy Dorsey, who's been a nurse for 40 years. And do you have any questions for her tonight?
I think I would just like to know, like, how hard was it for you, like during like nursing school? Like, I'm always so worried about that. Was that like a struggle for you going through nursing school and everything?
No, it wasn't, Isabella. And you know what? You've got the moxie. You're going to do just fine, because this profession, you can't go into it for any other reason than your love of mankind and wanting to help other people. And you certainly have that at a young age. The rest, you'll do just fine with your studies, because you've already got the drive. And you're coming in, I mean, you will be able to tell nurses 40 years from now stories that they can't even imagine. Because, as I say to the new nurses who start with us, this is something we've never been through, not this way. And again, I've lived through a lot of it, but this is so different and this is so horrible. And I hope that we're learning all sorts of good things from it. And you're right, some people don't listen. And people your age, I see a lot of them out. One of the union reps told the story the other day of going by a frat house, and here's a party going on. She actually got out of the car and went to the door and said, listen, you guys, you got to listen. This is not good. So I wish that some young people would be able to come with me, would be able to go with me to the morgue, would be able to see these patients that are suffering, that this is what happens when you don't pay attention. So it's great that you're spreading the word, but you'll do just fine in school. You'll do just fine.
Thank you.
Well, let me bring Stokes Nielsen in too while I have everybody together, just to kind of go around and get everybody's final thoughts tonight. Stokes, what do you tell people as we wrap up here tonight about this +2 project and the importance of donating plasma?
To kill the virus and past time to kill the virus. And we have all of these COVID-19 survivors that will be emerging from quarantine, that have the antibodies to be able to save COVID-19 patients in critical care and to defeat this virus. And we need to get the word out. So most amazing following, Chris. I want to give a shout out to everybody on your feed, the ones that do the good comments and the ones that even burn. I mean, honestly, those burns are some of the most creative burns I've ever seen on social media. So please get that those that are cleared from COVID-19 quarantine and can donate, get in the donation chair, get in the battle. Time to win war and kill the virus.
All right, Stokes, I appreciate it. You take care down in Nashville. Best to your family, and God bless.
Thank you.
Sandy Dorsey, final thoughts tonight. What do you tell people? What do you want them to know most about your battle in your medical hospital tonight?
Just, we want everybody to stay safe, stay home, don't go out. This is not, whatever you're suffering as far as being bored, is nothing compared to the people that are suffering in the hospital. Whatever we can do to stop transmitting this to each other, that's what we have to do. I'm excited for Stokes. I'm excited for that prospect coming out to see if we can't indeed kill this virus. But for now, we want everybody to stay safe and don't take any chances. If not for you, then for your grandmother, your parents. I want to live to see my grandchildren again, my great-grandchildren. We want everybody to stay healthy. So do what the experts tell us to do.
All right. Sandy Dorsey, thank you very much. Stay safe, stay healthy, and thank you from the bottom of my heart for everything you do at your hospital. I appreciate it.
Thank you, Chris, for having me.
Young Isabella, you're the youngest in the room tonight. You get the last word. What do you tell people? What do you want them to do tonight as we battle this COVID-19?
I would just like to tell them that I'm just so thankful. I'm so thankful every day that I've been able to have this opportunity to help the people that need it the most during this horrible time. And I would just like to tell some of the people that are my age that are, especially the seniors, like this is the most fun year that everyone has been looking forward to. And I would just like to tell them that we will be repaid for what we have missed so far, and there's definitely worse things to be going through right now. And having coming from someone who has seen such turmoil in the hospitals, that I promise you it can definitely be a lot worse. And I just hope and pray that everyone is staying safe out there and that they are following all the guidelines that have been set in place so that we can finally kill this virus hopefully soon. And I just hope everyone's staying safe. That's definitely the most important thing.
All right, Isabella Johnson, thank you so much for being with me tonight. I appreciate it. I got to tell you, your parents must be so proud of you. I'm proud of you. Good luck with everything, and good luck at college and nursing school. Thank you all for joining tonight. Again, the numbers continue to be staggering, but it appears we are turning the corner in many parts of the country. But as New York, Michigan, LA, San Francisco start to settle down, Washington State, they're looking at peaks very soon in Boston. I talked to Vinny Lavigne earlier. He was in Las Vegas delivering some medical supplies. Vinny, obviously, with the emergency task force. He's been on the show the last 3 or 4 weeks. He'll be with us again next week. We tried to get him on from his jet, but the signal was a little tough, so we'll visit with him next week. Anyway, thank you very much. I think there was a lot of good advice, a lot of interesting things tonight, talking to the old guard, the new guard, and people in between. But I think the important takeaway here, one of the important takeaways here, is this plasma testing. And so for anybody who is eligible, who can be a part of this, I sincerely recommend it, as do the medical experts. So tomorrow night, we'll be back at 8 Eastern as we continue our investigation into Davi Vanity and Onision. We've got some very powerful guests who will be on the show tomorrow night, victims and survivors. In the meantime, please stay safe, stay healthy. Remember, I'll be watching, and we'll see you tomorrow night when you have a seat with Chris Hansen. Thanks. Have a good night.